Well, let's speak to Dr. Hans Kluge, the WHO Regional Director for Europe, who joins us now live from Gaziantep. Good to have you with us.
Thank
Clearly,
you.
there are so many vulnerable people right now living in temporary shelters. What are the concerns regarding their health, and how is the WHO assessing their public health needs?
Well, first and foremost, I must say that I was very impressed by the massive response by the government. 50,000 patients from the affected area have been evacuated to other parts in the country. 1,000 ambulances were sent to the regions here. And I was particularly impressed when I met UKME, the National Medical Rescue Team, 14,000 Turkish volunteers going to the most remote areas to help the people. But indeed, as Dr. Fahrettin Koca was mentioning as well, the Minister of Health, the area affected is 50,000 square kilometers. So it's more than Switzerland or Belgium. So international support is crucial. The WHO has launched a so-called flash appeal for $80 million, $50 million support in Turkey, 30 million for Northwest Syria, and only 10% has been received. So I do see a discrepancy between the expressions of solidarity and support and the actual support arriving in Turkey.
I know that the WHO already had a field office in Gaziantep, so you're obviously very used to working closely with Turkish authorities. How crucial is that international assistance going to be in the long term as the recovery efforts and rebuilding efforts continue going forward?
Indeed, the recovery effort will be huge. We are working together with the Ministry of Health on a needs assessment, also then the reconstruction. And one huge need that we discussed with Dr. Fahrettin Koca is on mental health. Obviously, people are traumatized, the people directly affected, but also what I call the helpers. We have to help the helpers, meaning the doctors, the army, the police, the religious leaders, even pre-deployment. Because, of course, last night here in Gaziantep, I was also feeling an afterquake, and we know that there has been thousands of afterquakes. So in that sense, it's important to scale up the mental health needs. And we also discussed with the Minister of Health the post-traumatic rehabilitation, because about 1,000 children and adults had been amputated. So wheelchairs, prosthesis, assistive technologies becomes more and more important.
It's clear that a lot of medical support is going to be needed. Can I ask you about the situation over the border in Syria? Because that has been a really difficult situation trying to get help to the people in Syria. What is needed there regarding earthquake survivors?
Absolutely. The needs are huge. Over the last many years, WHO always have been assisting the people in Northwest Syria through our office in Gaziantep. And I really want to thank the Turkish government for that collaboration and support. But there was only one cross-border point, Bab al-Hawa. Now at least we have 3 cross-border points open. Our WHO Director General, Dr. Tedros, was in Damascus a week ago, and there is some opening for cross-line support. But this support has to be massively scaled up. We are reaching only 1/3 of the population. We have to aim immediately to 2/3 and then 3/3. There are about 580 confirmed cholera cases in children 4 years old or younger. And medicines are coming in, but there is a need for more heavy equipment, meaning X-ray equipment and CT scans. So really the international community has to step up to open up the borders so that help can flow in massively.
And you talked about the particular needs of children. I'm guessing on both sides of the border, children are particularly vulnerable, particularly the ones who've lost their family members in the earthquake. What efforts are being focused specifically on the young victims of these disasters?
I had a great opportunity to talk to the child psychologists in one of the camps, doing a great job. Also the volunteers of UCME. And there is a large volume of what we call complicated grief. If, for example, relatives cannot be buried or according to religious rites, or there is no body to bury. So in that sense, this trauma is indeed there. There is the physical trauma. We saw children with limbs which were amputated, but their assisted technologies can also have some relief. But the mental aspect is very important. And then the sustainability of basic medicine supply. The Turkish Pharmaceutical Association is doing a great job, but this is in the acute phase. A lot of pharmacies are destroyed as well. So be it for children or women or elderly people, the pipeline, the sustainable pipeline of basic medicines will be crucial as well.
Can I ask you a personal question? I know the WHO is no stranger to dealing with disasters, but for you personally to come into a situation, to be in Gaziantep, you said you could feel the tremors, the aftershocks yourself, and you see so many people dealing with losing everything, losing loved ones, losing their homes, losing their cities. What impact has it made on you?
A huge impact. I have been in emergencies all my life. We're together here with very seasoned people from WHO. But to give one example, this has been the largest deployment of emergency medical teams in our history, in our 75 years history of WHO. This is definitely the natural disaster of the century. But then again, I feel optimism. I mean, the resilience of the Turkish people, of the volunteer society is huge, but we cannot underestimate the long-term impact. WHO, as you rightly say so, has been here, is here today, and we're going to continue to stand with the Ministry of Health and the Turkish people as long as needed.
Dr. Hans Kluge, thank you very much indeed for joining us. Good to speak with you, the Europe Regional Director of WHO there.